Are evening out, so I'm going to go ahead and get us started. Welcome to today's webinar, Mental Health Disabilities on Campus, Student-Driven Priorities for Change. My name is Jackie Zimmerman. I'm the Manager of Public Education Partnerships and E-Learning at MHA's National Office, and I'm joined by my colleague Kelly Davis to help moderate today's discussion. I have just a few notes for everyone before I hand it over to our speakers and let them introduce themselves. This webinar is being recorded and will be emailed out to all registrants within 1 week. We currently do not offer CEUs, but if you would like to request a certificate of attendance, we do have a form that you can fill out and those will be sent to you. I'll post the link to that form in the chat here shortly, and that will also be included in your follow-up email if you can't access it from the chat. Like I said before, your cameras are automatically off, your mics are automatically muted, and they will stay that way throughout today's session. That's why we encourage you to use the chat to make comments, post resources, and ask questions. We will have a little bit of time at the end for some Q&A, so please ask your questions in the chat. We'll be collecting those throughout the session and then have some time to go through a few of them at the end. Welcome, Kelly, Delicia, and Nev. I am going to hand it over to you for the rest of today. We are so excited to have you here talking on such an important topic. And so, Kelly and team, take it away.
Awesome. Thanks so much, Jackie, and thanks everyone for joining to talk about a really critical topic that I think even when we're talking about higher education and mental health is often left out. So we're going to be talking about mental health disabilities on campus and a project that we've been working on this year to identify student priorities and students with mental health disabilities for how we can make campuses more accessible. So first, we'll start with introductions of all of our panelists. We'll give an overview of the issue and the project. We'll go through the student recommendations, and then hopefully we'll have a little bit of time for Q&A. So before we get started, wanted to give a funding acknowledgement. So this project, much of the work is part of a PCORI engagement award. So we have been working with PCORI, but we have to give the disclaimer that the views, statements, and opinions in this session are not representative of PCORI, but we are really grateful to them for being able to do this student-centered work through our engagement award. So I'll start by introducing myself and then turn it over to Nev and Delicia. But I think really critical to this work, right, is lived experience. So as you can see, my name's Kelly. I am the Vice President of Peer and Youth Advocacy at Mental Health America. I've been here for 8 years, started right after college graduation. And, I work with young people and in peer support and lived experience leadership. But for me, this work is really important because of my lived experience. So background about me, from an early age, I felt like something was different in how I was perceiving the world compared to the people around me. I had my first suicide attempt when I was 10 and spent kind of my childhood and adolescent years in all sorts of varying intensities of mental health treatment and services. And by the time I was 19 in college, I was really just having a horrible time and almost failed out and lost my financial aid because of my experiences with bipolar disorder, mania and depression, and substance use. And I think for me, the thing that changed my life the most was, one, peer support, so connection to other people with shared experience, but then also disability accommodations. So as someone who first got connected to the mental health system when I was 10, I didn't get any accommodations for my disability until I was 19. And unfortunately, that is extremely common among students and young people for a number of reasons, including a lot of people who are in even if you have access to all sorts of treatment, do not know anything about mental health disability and disability law. Just to add a quick note, and then we'll turn it over to Nev to share about her story, is that I actually, as someone who cannot stay away from higher education, submitted a grad school application last night. And for those of you who know or are familiar with Reddit, I'm getting grad school subreddit updates, and the update was, do I deserve my degree if I use accommodations? So not only are there massive barriers to um, getting accommodations, getting support, but even if you have it, there is such deep internalized stigma and discrimination from staff. So I just wanted to add, a lot of this information you find from talking to people and on subreddits, on forums. So I'm really excited about this work because it's a really big problem, and we don't actually even have that much information easily available to people to kind of process their experience and figure out how to navigate higher education with a mental health disability. So with that, I will turn it over to you, Nev, and then Delicia to share about your work and also why this project matters to you.
Awesome. Thank you, Kelly. It's so great to see this number of people here. And I see, although everybody hasn't put their affiliations or organizations in the chat, a number of you have, and I see a real mix here of like folks who are working in college campus settings and also in the community and community mental health, juvenile court, et cetera. So it's really wonderful to see such a mix. And I think, just to say a little bit about myself, a big part of my sort of kind of commitment to transforming the campus mental health space is my own experiences, and specifically in my case, having been terminated from the first graduate program that I was in because of a schizophrenia diagnosis. And, really kind of the consequences of that were life-changing and really just profoundly demoralizing. And I went through then like kind of years unemployed, not in school, in intensive services, just literally every minute of the day, just wanting to end my life. To have gotten back into higher education then and be where I am now, it's hard to even kind of imagine all these other possibilities that might have been my life. In my work, which focuses very squarely on, youth and young adults who are labeled with SED/SMI in various forms. A lot of my work focuses on psychosis and sort of schizophrenia spectrum specifically. But the programs that I generally work in, juvenile mental health courts, intensive community services, coordinated specialty care for early psychosis, and overwhelmingly, I see youth and young adults who don't even have access to higher education or who have been, kicked out, forced to withdraw, forced to leave, and see no pathway back. So overwhelmingly, right, the majority of people, and I am constantly thinking about how do we bridge this, because there's already, sort of the problems, the challenges of the struggles of students who can get in. And then there is this like huge gap between the number of youth and young adults with significant psych disabilities and just really no access, structural problems behind that, like, just student debt, I think alone just dissuades many, many, many people from pursuing higher education. So it's great to see you all here. And again, just this mix of people, because I think big part of this project is trying to bridge these things, is trying to kind of get beyond everybody's well-being is important and we need to strengthen, kind of well-being and mental health in general on campuses, but also that there are these really staggering divides between who has access to higher education, who has enough support to succeed, and what that means in terms of people's lives and long-term poverty and long-term other ways in which social exclusion plays out if you don't have an education, if you're unemployed, if you're living in poverty, et cetera, et cetera. So now I will turn it over to Delicia, but again, great to see so many people here.
Thank you so much, Nev. I'm so happy to see the hundreds of you here. I'm a little nervous, so please forgive me. This is a lot. My name is Delicia Thompson. I am a former educator. I was a teacher overseas in Taiwan. I was also a teacher at the University of Maryland, College Park. I have had major depressive disorder since early childhood, but I was not officially diagnosed until I had a severe racially traumatic experience while I was in college. Um, and I was lucky enough to have a guardian who was in the field who could do all of that navigation work for me and had the social capacity when I did not have it myself. And I took all of those lessons learned and became an educator, and then had students who were dropping out and not coming back to school because they were having mental health leaves of absence. They didn't have the resources. And I felt really not very empowered. So, similar to Kelly, I have decided to transition into the legal field because I want to enforce the ADA and other policies to ensure that students are being able to access accommodations and other things that they need. So I come into this work with both a teaching background as well as a policy background, and then hopefully in the near future, a legal background. And I will definitely be sharing very specific areas of crisis response and prevention when we get there.
And then I wanted to also just highlight, do you want to go read through everyone's names? So we'll talk a little bit about the project process, but this project was really driven by, and the recommendations that we'll share today are current and recent college students with mental health disabilities. So this is just the list of our work group members that we wanted to take a moment to acknowledge, because they really have been the driving force and behind the project and behind the recommendations that we'll share today. And then I'll turn it over to Nev, who will share a little bit of additional context about the issue and about this project specifically.
Awesome. So next slide. So these are just some news articles, headlines from major papers and media outlets, some recent, some going back a number of years. And I think kind of what we want to just kind of briefly highlight is the reality that the pandemic made a lot of things worse, including just the amount of additional kind of pressure put on student disability services, because COVID, became kind of bundled into disability accommodation processes and protocols, and really kind of exposed how kind of weak and under-resourced that kind of disability infrastructure is on many college campuses. Kind of same thing in terms of campus counseling being overwhelmed. And I know, many of you on this call, I think, are representing campus counseling centers and are, I'm sure, very well aware of this. At the same time, if we go back years, we would find very, kind of, and do find similar headlines, similar stories. So there really never has been a time, especially for more stigmatized, intensive, disabling, and/or liability incurring conditions and experiences. And I mean that from the perspective of universities, right? Is that the way that students, for example, who engage in some form of self-injury, even if it's non-suicidal self-injury, and then kind of suicide-related liability and concerns have definitely kind of fueled a lot of exclusionary policy making on college campuses, the sort of remove the liability from the campus environment rather than restructure and reimagine services in a way to support people. Another vector here is college and campus mass shootings, which have also led to surveillance infrastructure that didn't exist 20 years ago. Students of concern reporting. And students of concern reporting is another way in which students with significant and stigmatized disabilities can be kind of swept up and then excluded from or pushed out of college campuses. So There are new pressures coming from COVID, I think, big picture, and we have never been well, so to speak, on college campuses. And so we're really kind of trying to leverage the momentum of the attention to the sort of the youth mental health crisis, the young adult mental health crisis, which, you know, kind of everybody, the Biden White House is talking about, et cetera, but also to say, you know, actually a lot of the building blocks here that would really lay a strong foundation for support and disability inclusion, they've never been there. They're a bit more exposed now, and we really need to seize this opportunity to take action, which is what this project is all about, with a more research spin, just, you know, in part because of our funder here, PCORI, which is a research focused entity. And then just to kind of reiterate here, particular concern with kind of highly stigmatized diagnoses that are also less prevalent. So people are less used to seeing them. They're less used to seeing them in part because there's so many barriers to students getting into college, as one would see in the projects that I do, focusing on youth who have been justice system involved, youth who have been you know, experiencing, you know, SED across multiple systems or early psychosis. Like, very few of them get into college, and hence we see them less in college campuses. And they're rarely part of the mental health conversation, the sort of more general well-being oriented or sort of milder depression and anxiety oriented conversations and, you know, kind of stigma reduction campaigns that we see. This converges or intersects with racism and classism, I think, in very, very powerful ways. And that has been a huge priority to this project. And intersections with racism that also specifically play out in terms of who ends up under surveillance, who is identified as being potentially dangerous by their classmates, who ends up disproportionately subject to involuntary interventions of various kinds on college campuses. And we have parts of those conversations. We might talk about the general well-being of students of color, but I think, like, you know, these harder conversations where that meets stigmatized diagnoses, converging stereotypes, and responses that are often much more about trying to remove the person, push them away, move them out, than to support them. And then I think the sort of the failures of the Americans with Disabilities Act, the ADA, especially when it comes to mental disabilities, is a real driver behind this project. The status quo way in which the ADA has been implemented does not level the playing field. And I think that's not even a question to legal scholars at this point. That's just kind of widely accepted. So we need something more. And I think we really need to understand that what we're doing does not really work for an awful lot of students with disabilities. And if we want to really move the dial on long-term outcomes and college success rates, we really have to do things differently. We need some more fundamental rethinking here. Okay, thanks, Kelly. Oh, and just a project timeline, which I don't think that we have to go through, but just to kind of give you a sense of the project overall. We're near the tail end of the project, and what we're going to be talking about today, and we'll soon be releasing publicly, are kind of consensus priorities and specific recommendations tied to, and you'll hear more about this, so I'm not going to kind of belabor the point, but what you'll be hearing about will be like released in more kind of official form, and we hope to really use that and leverage that to push for change. Do you want me to just so this is just, I'm not going to walk through these because we will now, the three of us will kind of walk through these briefly individually, but these are sort of the topics or priority areas, you know, kind of racial justice and intersectionality, structural and social determinants of health among college students, crisis response, what it really looks like to develop robust peer supports on college campuses, this general backdrop of exclusionary and discriminatory practices and policy and the need for change, accommodations, Then from a research perspective, centering the most impacted in research development and design, and then kind of to relate it, like really it's kind of supports for students with SEDSMI, one approach being supported education that we need a lot more investment in, and one which often is delivered by community mental health orgs rather than college campuses themselves. And then kind of from the college side, what would it really mean? Like if we ask ourselves, what would it really look like if college campuses became super supportive environments for students with, kind of really significant, highly impactful long-term psychiatric disabilities? Okay. And then Delicia.
Yes. So first things first, we cannot do this work without recognizing, um, racial bias and the need for racial justice within the mental health care apparatus. As it stands currently, students of color and particularly Black students are experiencing the negative consequences of this, as Nev was alluding to earlier, these new threat surveillance models. So they're more likely to have the police on them and receive a carceral response. They're more likely to experience involuntary hospitalization. And unfortunately, depending on what literature you're looking at and reading, you will see things like race is not a factor in help seeking behavior. It's really the student's perception of threat or harm that could come to them. And as we all here hopefully know, you cannot separate race and perception or perceivement of a threat. So we already have an issue in the literature of an inability of capturing what students of color need and in terms of the models, in terms of responsiveness. The other side of that is the non-acknowledgement that our models, when they are given to providers, administrators in the higher education setting, need to have bias training. Because Black bodies and bodies of color are seen as more threatening, you need to have administrators address these internalized biases so that they do not escalate something beyond what it needs to be escalated to. So I focused on crisis response. And if you are in a university setting, you know that university models tend to favor things that are crisis prevention. But when it comes to the intervention piece, when there's an active crisis going on, universities tend to over escalate a scenario that ends up happening. The most common violations in terms of law end up being the Fair Housing Act, Section, I believe, 504, the Rehabilitation Act, and obviously violations of the ADA. The Fair Housing Act is a very common violation because often when there is a sense of a perceived threat on campus, housing is terminated, which goes into the structural and social determinants of health. During a crisis situation, how universities respond can either exacerbate often the crisis that's going on. So if a student is having a panic attack, for example, and ends up going to the hospital because of that panic attack, their housing gets terminated, and now you've caused housing insecurity. So you've added another crisis on top of the one that was already happening. So our students and other research participants, we believe that making sure that universities are addressing those external factors, food insecurity, financial turmoil, or housing insecurity, those kind of external stressors, those should also be addressed in prevention and interventions by institutions. I firmly believe that institutions should not just have a unilateral cut off your housing as immediate first response. At the University of Maryland, that is no longer a response that is tolerated at my institution because of intense lobbying by myself and other students. But it is a very common practice just generally in the United States. So We want to think about things that maybe for our food insecure students, maybe they need access to free meal plans and things of that nature, because financial situations, stressors can change over time, and university models need to be able to bend to address those things. In terms of the gaps, there's a lot of gaps in the research, quite a bit. The biggest, in my belief, the biggest gap problem is there's no standardization of these threat response models. Every university has an internal working mechanism of what they perceive to be a threat, what is a threat, what constitutes a police response, how they train faculty in terms of their role as mandated reporters. There is no transparency for that. So while we have models like Cognito and mental health first aid encouraging help seeking behaviors, what that ends up resulting in, if you train administrators to perceive things as threats, is the more students seek help, the more that they end up being reported and escalating of a situation when it really didn't need to go there at all. We also have the issue of there's a lack of CER eligible interventions. CER is, comparative effectiveness research. There are certain standards you need to meet to qualify for it. And right now, sort of the progressive things that we want as researchers, as people with lived experience, they're just don't qualify as of yet. But hopefully we will get there. But mainly, whatever models, wherever we go into the future, those models should not exacerbate a crisis being experienced by a student or faculty member or other person in the university apparatus. That's like the main full stop has to be the goal. And I will turn it, I don't know, is it Nev or Kelly is next?
It's me. I'm next.
Okay.
Thanks, Delicia. And there's actually I guess, link between something that Delicia was talking about, just as an aside, around discriminatory and Nev's comment about the ADA. So, for example, Delicia mentioned the 504, and the Department of Education Office for Civil Rights was looking for comments because they're updating these regulations. And one of the issues that we raised specifically, because we all work directly with students and young people, is that even when you have accommodations, sometimes your accommodations is reducing your course load, but then there are financial aid related requirements to maintain a certain student enrollment status. So there's a lot of different ways where this shows up, and it's actually extremely concerning that if you Google, if you're on forums, if you're on Reddit, you can find these things out if you talk to people. But again, it's not a widely discussed and documented issue. I'm going to talk about 3 additional priorities that came up in our conversations for recommendations. So first, peer support programs and collaborations. The Born This Way Foundation also put out a paper, I think last year. Peer support is extremely popular and in demand among young people. Often in higher education, there's barriers around this liability concern of, what happens if a student's in crisis? What if we will get sued? Kind of really viewing these highly demanded programs as more threatening. So one of the kind of core issues that was brought up, one is like, we need more investment in these programs. We overwhelmingly need more research about these programs, because another really significant issue when you're talking about peer support among young people and in higher education is people are saying peer as in, right? Peer is just like, as a term, it's a relational term, right? It's someone who you share an identity or experience with. And a lot of campus peer programs are student to student. And even those that are student to student with mental health diagnosis often exclude students or do not have training or experience supporting students who have these more stigmatized experiences. So it's critical not just to invest in research and documenting what's happening in peer-to-peer programs, but really making sure that they're equitable and inclusive and aligned with the peer support movement values that make sure that we're really making space for everyone, not just less stigmatized experiences. The second is exclusionary and discriminatory practices. This is related to the accommodations and navigation support. I think one of the things that came up repeatedly, right, as part of this project, we were trying to identify different interventions that we could recommend additional research on. And one of the major challenges is that we just don't have a lot of data about anything that's happening. So separate from being able to identify what's working, what students want, we really emphatically need information about what's happening. And that has ended up being kind of a cross-cutting at the top. For us to be able to make these policy arguments and recommendations, we really do need to know what is happening on college campuses, to the point where one person in the field was doing Freedom of Information Act requests because colleges just aren't letting this information out there. And we know from working with student advocates, one of the best ways to make a college campus do something is to very publicly accuse them of misconduct, right? And then the other piece too around exclusionary and discriminatory practices, when you're looking at the kind of higher level campus community, is these approaches that are mental health first aid, mental health education, often don't include anything about disability. So a lot of the barriers, like first, knowing that mental health disability accommodations are a thing, navigating that belief that I mentioned earlier, that a lot of there's a conversation about our disability accommodations cheating and all of that, and a lot of students themselves feel like they're cheating when they're using accommodations. So no real, when we talk about stigma reduction, a lot of the stigma reduction is around depression and telling people to get help, but virtually nothing around disability and engaging in disability supports. And then finally, on the accommodation staff side, a lot of students report that even when they are accessing accommodations, the campus staff who they're working with actually aren't really familiar with psych disabilities, and instead recommend kind of broader accommodations like extended time on tests, extensions on due dates that don't necessarily meet their specific needs. And then finally, accommodations and navigation support. So I think one of the most absurd components of the accommodations and navigation support topic is that a lot of the process, right? So the vast majority of schools do not allow you to use documentation from K through 12 if you were already getting disability accommodations, and instead require you to go through the process again. A lot of students, by the time that they're reaching out for accommodations and support, actually are really struggling. And the idea that they have to potentially find clinical services that aren't available, make multiple appointments, put together a bunch of documentation, when the accommodations that you would be requesting are extensions on deadlines, are flexibility in attendance. It's really like very absurd that a lot of the process of obtaining accommodations are the accommodations that are being requested by students. So the process of getting accommodations from the accommodation staff is just extremely inaccessible. Students brought up the potential to have peers as navigators, something that exists often outside of campuses, but we aren't aware of any research on peer navigation in higher education, specifically around disability. And then finally, even when you get accommodations, you run into the issue that many staff have wide discretion on whether or not they will actually honor your accommodations. So there's also the additional gap of making sure that staff have education, but also that students have support in being able to advocate for themselves. It is very unfortunate that so much of this falls on the individual person. And that was also something that came up repeatedly, right? Is like you become extremely demoralized when you're constantly having to fight for yourself. And often when you are kind of putting yourself out there as an advocate, it can also kind of make you a bit of a target for pushback or harm from other folks. So those are just a little bit about some of the recommendations and experiences that students had across those three topics. And then I will turn it to Nev to talk about three final issues before we open it up for about 10 minutes of questions.
Awesome. Thanks, Kelly. And yeah, this is very fast paced, as I'm sure you all, we had 1 hour and we wanted to kind of really just briefly talk through each of these priorities. I just want to emphasize that we would really, really welcome, outreach, further conversations for those of you listening who are really kind of interested in engaging more. We're doing a lot of active work, and that's only sort of, we're scratching the surface in terms of the presentation. So just kind of starting with, as I mentioned, the sort of idea of centering the most impacted in research development and design. The same thing could be said for policy, for program development, right? And although we pay a lot of lip service in the research world and higher ed to lived experience, it really remains more the exception than the norm. And I think in the mental health space, one of the challenges is that we have an extremely broad umbrella. In some sense, every single one of us has at some point in their lives experienced depression or anxiety. So in one way, it would be everyone. When we kind of look at one end of the spectrum, we see really intense exclusion, right? Lack of access to higher education, period, in many cases. So the idea of the most impacted, this is a phrase that comes from the disability justice movement, is who is not benefiting, or on the flip side, who is really being harmed by things that other people are not being harmed by because they have more resources, because they have more privilege. How do we really center those perspectives? So I think this is like, a big kind of motivating theme here, where we're talking about not just kind of psychiatric disability, but also poverty and race, and, other forms of sort of discrimination related to LGBTQ status, for example, or identities. So we really, really want that to be front and center, and for initiatives to really think about the spectrum of who needs to be in the room, right? So if there's campus reform going on, it's not just, I don't know, student government representatives who are probably like doing quite well and popular and, have lots of friends on campus. What about people who really aren't doing well, who are excluded, or who don't even feel, like they can speak up for themselves? And then the next two areas, as I mentioned when I just kind of quickly went through this, really refer to kind of how do we bridge this disconnect between students with, again, what kind of traditionally would be labeled SEDSMI, an acronym which refers to long-term psychiatric disabilities accompanied by significant functional disability is how most states operationalize the sort of the boundaries. So students who historically access and graduate from higher ed at incredibly low rates. So how do we get more people in, and how do we support them once they're in? So supported education programming historically has mostly been, there's exceptions, but mostly been sort of pioneered and led by community mental health providers, who are really, developing resources, staffing to provide coaching, assistance with applications, peer support, study skills support groups, et cetera, et cetera. Sorry. So there has been development, and there's a lot of gaps in the research literature. We don't even have the level of research behind supported education that constitutes it as an evidence-based practice, for example. So as important as it is, really neglected from a research and policy and financing perspective. And, then kind of we could dig into details about what kind of supported education program really works, especially in the context of kind of poverty, socioeconomic deprivation, and racism. Like, are we doing enough to think about these layers upon layers of barriers that students may be facing? And do we have programs that are really kind of adequately resourced to help overcome those? And then I think when we flip to the university side, definite overlap here with what Kelly was talking about in terms of just general exclusionary practices on college campuses. Sorry, I have a sick 4-year-old who is interrupting, Zoom bombing us. But reimagining university policies, just to give you like one example from my personal experience, the first time I went to the Student Disabilities Center after I was diagnosed with schizophrenia, the director of the center herself met with me. She asked what my diagnosis was, and the first words out of her mouth were, "I've never worked with a student with schizophrenia, and honestly, I think you should rethink whether graduate school is even an appropriate path for you." And I sobbed and I left. And then after that, I actually got in trouble. I got reprimanded for not having formally pursued accommodations when I literally could not psychologically even take the level of sort of just discrimination and stigma that I encountered from the director herself. So, that's just one example, not that long ago, right? I think this sort of thing still very much happens, where we are we do not have college campuses that are somehow kind of stigma-free or embracing integration and inclusion. And this is a white female graduate student who had straight A's. So imagine, Kellyanne, I think, was saying this in the chat earlier, imagine if I had been a Black man without the same, it would be tenfold worse, and it was already terrible. So I think the big question here is what this would really look like. And we have every reason to believe, even where we don't have the hard data, that surveillance policies, student of concern reporting, police call outs, kind of campus police or campus resource officers, right? That this is must be disproportionately impacting students of color with psych disabilities. And that is really concerning, because if you're pushed out of a college campus, what it means is that you're pretty easily kind of pushed into a path of poverty and socioeconomic disadvantage relative to folks who are able to get through college, maybe get through graduate school as well. I think it's in the kind of, psych disability, mental health service user movement, sort of mental, kind of mental disabilities are often talked about as undesired diversity on the part of college campuses. So where we desire certain types of diversity, we want to exclude other kinds, and absolutely SED-SMI, and then especially when it intersects with other oppressed identities is absolutely in this category. And we need to acknowledge that that's the case, right? It's sort of like the first step towards change is just sort of the acknowledgement that this is a major problem. And then really kind of really building out concrete policies and practices that change culture and climate and infrastructure in a really different way. Not just we have a counseling center and we have student disability services, but other ways in which we signal investment in integration and inclusion and building out more robust, beyond the kind of minimal requirements of the ADA, really more robust ways to create supportive networks, accommodations, kind of coaching and support for students who have, significant psychiatric disabilities, but simultaneously so much to contribute, right? Like, unless we really believe that, well, there's a whole group of people who should just be excluded from higher education, we really instead need to think about how we include a greater number of people, and by including them, really kind of guard against the kind of the poverty that in many cases otherwise becomes, kind of inevitable or very likely. Okay, so I think just turn it back over to Kelly for a second, but basically now we have time for questions and discussion.
Yeah, thank you both. I don't know if Jackie's coming back on, but Jackie sent some of the questions. We have about 10 minutes to answer questions. I have some of them here. I just wanted to say thank you all so much for sharing in the chat. Unfortunately, a lot of these are really common experiences, and I know I'm grateful for people's vulnerability in the chat as well. I know during this project, I really realized when being in the presence of the student work groups together, how rare it is to be in a space where a lot of people share this experience and are talking about it. So just wanted to thank you all for sharing, for the work that you're doing, and then Jackie, I want to guide us through some of the questions.
Yeah, absolutely. Thank you, Kelly, Nev, and Delicia. That was so helpful, so wonderful. And just to echo Kelly, we appreciate everyone who's here joining us and the sharing of your experiences and things that you have witnessed. And along with this topic, it is something that we realize is a large challenge, as all of our panelists have so greatly identified. And it seems like a lot of you have experienced this as well. And so I appreciate everyone for asking those questions in the chat. Feel free to continue asking questions, and we'll go through a few here as we have some time. One question that I want to start out with is how can we support students to come forward with their needs without setting them up for diagnostic labels and dangerous psychotropics, along with stigma and discrimination? We've talked a lot today about how stigma in different settings can be really, really harmful, especially this one. And so I just wanted to uplift this question, and thank you for asking this in the chat.
I can just briefly kick this off, speaking from the perspective of a faculty member, instructor. I teach everything from undergrads through to doctoral students. And I think we can have we've been having some internal discussion about maybe some of the limitations of universal design, but I think the basic premise here is really important, that rather than creating exceptions in a classroom environment that are premised on students getting a diagnosis, documenting impairments, to use the exact ADA language, having to go into student disability centers, all of which is sort of kind of fraught and riddled with problems, right? Because of discrimination, people maybe experience the costs of documentation, and how that impacts students who don't have financial resources or insurance, and de facto kind of keeps them out of the process. But so there's many, many reasons to be concerned about a system that only makes accommodations based on documentation. Universal design says what we need to be doing is creating classrooms or other types of environments in which that are sort of built for a diversity of needs, abilities, skills, backgrounds. So for example, not saying papers are due on these rigid dates, and only if you're a student with a disability who has a documentation letter, then you can turn it in later. But instead saying, hey, I have a flexible policy. If you are struggling because you're a single mom, if you're struggling because you're a caretaker of a parent, or because of a disability, or because you just got COVID, it's the same policy for everyone. multiple ways in which students can complete assignments, that is just part of the syllabus, right? Like not a 20-page term paper with APA style references. If you're more comfortable creating a video presentation, if you're more comfortable group project, you can fulfill the requirement in different ways that may be easier, depending on kind of who you are in your background. So I think that is just a classroom example. One can think about universal design and radical access across every aspect of a campus environment. So I just want to 100% agree that there are really serious limitations and risks of systems in which everything, all your access to supports is premised on a diagnosis. And of course, this also happens with maybe less ability to change that within the kind of mental health and medical system, right? Where billing really does become often kind of premised on the assignment of diagnoses.
I just have two quick things. I think one, it also, in addition to individual classrooms and professors, I think part of it is really tackling how extremely toxic higher education is like you are only valuable and achieving if we overwhelm you to the point where you almost can't function. That you hear that over and over again. All of my conversations with students at any school around the country are saying, at my school, there is such extreme pressure, and I can't take a break. So it's like we support mental health. We have these conversations about mental health excused absences, but I know on college campuses, the students were mad that they closed campus for a day because they were like, I have to make all of this work up. Like the pace and the pressure and this idea that you are only doing valuable work if we are pushing you to the brink of like exhaustion. I don't think that makes anyone much better at anything. So I think there's just like extremely toxic norms in higher education. And the other thing that I think, and then I wanted to give Delicia time to provide thoughts, is something else that came up is just when we're doing education around disability and accessibility, working directly with students, working with faculty, working with staff, but also working with TAs. If you're thinking about accessibility and accommodations, right, that might work really well if you go to, like, I went to a small school. I had like 30 people in some of my classes. I built good relationships with some professors who had lived experience, who were like very accommodating. If you're in a 200-person course, I think it's hard from the professor side, but also from the student side. They're really a lot of times interfacing with other students and TAs and assistants. So I think making sure that we're training all of the people who are working directly with students in the classroom. And then wanted to pass it to you, Delicia.
Thank you so much. I do want to respond to this question. It says, how can we navigate these supports for students when we get pushback that we are not setting them up for success when they get into the workforce? I want to push back against that very, very strongly. As a 19-year-old, when an institution does not have transparency, does not have easy facilitation, does not have some of the aspects of universal design that Nev talked about, instead of making it like, it's very similar to how we talk about diversity, equity, and inclusion. If it's not just laced throughout, if it's not baked into the system, then you're othering individuals and things. So if a student is entering onto a campus and it's already layered and baked in, we're already talking about it, orientation, here's the resources, here's what to do, here's how to know, like, prevention of problems, here's where you can go safely to talk about those problems. I think it's actually easier when you, quote, go out into the real world, because you need to know and have those tools to self-advocate in a job setting. You need to know that a job has to also provide you reasonable accommodations, because we have federal law that applies to both higher education and the job setting. So if you are being denied reasonable accommodations at a university level, that also teaches you in your head that I probably can't fight for these after you leave campus. And that is incorrect. That is not the impression we want to give students. And it's also very just displeasing of a narrative. It's pejorative because it's it frustrates me for so many reasons, but one of the things that COVID brought out was the fact of there were so many people that were asking to be able to work from home and have that as a reasonable accommodation. Suddenly COVID happens, suddenly companies and everybody can figure it out how to make things easily and more accessible from work from home. So it's the same thing. It's we need people to be able to push for these things so that my students that I've had in my past are prepared for the workforce. They know they can advocate. They know that they have their rights and what they are entitled to under federal law. So I say if you don't do this up front, you are actually setting up people for failure because they don't know how to self-advocate.
Thank you, Delicia. Thank you so much for answering that super important point that we think about as we continue this type of work. And you very eloquently put that. So thank you each panelist for helping answer that question. I know we are right up at the end of our time and it has gone by so quickly. I'm sure we could all be here another hour. But I want to thank you. And before I close us out, I just want Kelly, if you could answer this one question, as we have a lot of people interested in this type of work. Someone had asked, is there a best place we can follow the progress of this initiative and research? So as for next steps, I know there's going to be some more information published. Where can people find that?
Great question, Jackie. I just put it in the chat. So that is our website. And Delicia dropped our email, our contact information. You can also find that on the website. But yeah, please reach out and we'll be posting things there as they're published and available. So yeah, appreciate you all joining us for an important topic and for your work and sharing your experience.
Yeah, thank you, Kelly. And we'll be sure to include that link in the follow-up email as well. Again, thank you all for joining us, for sharing your comments, your knowledge, your information. We really appreciate everything that was shared in the chat with us today. We will be sure to follow up with the recording of this conversation. You'll get that within 1 week. That'll also include the link to continue following this type of work and the link to request a certificate of attendance if you would like one of those as well. So thank you all. Thank you again, Kelly, Nev, and Alicia for this amazing conversation this afternoon. And we hope everyone has a great rest of their afternoon and week.
Thank you so much, everyone.
Thank you.